Hello, this is our third webinar in our series that we're doing in partnership with Labor and Industries. Our first two webinars were on indoor workplaces and COVID-19 guidelines, and then outdoor workplaces and COVID-19 guidelines. So basically what to do to keep office workers safe versus what to do if you have a plant nursery or a construction company. So those are available on our YouTube channel and LinkedIn. On our website, we have a COVID-19 education page. This topic today is going to cover a lot of ground. It's on masks, and we're going to go through the state guidelines for fabric masks, face shields, and all of that. And then we're also going to talk about N95s and other respirators and go over the basics of building a respiratory protection program. So there's a lot of material we'll be covering today. Definitely ask questions whenever you think of them. You don't need to wait. Just type them into the chat. We'll address them, or I'll say, oh, we're going to address this in a couple of slides. So please put in your questions. It is divided, so the very last section of this talk is building a respiratory protection program. And if your workers have no need to be in N95s or greater, you are welcome to head off after the portion that's relevant for your workers. So with that said, I'm going to stop having a live video and go into the talk. So as a brief summary, and people who have been to my other talks know I always start with kind of where we're at, what we know now. COVID-19 is a very systemic virus. It's no longer thought to only impact the lungs. Now we know it impacts your kidneys, heart, brain, blood vessels. So it's a whole body virus, not just your lungs. And we now know that it's primarily spread through airborne and droplet transmission. And the basic difference, and we'll go on to that in the next slide, is the size of the particle. So when things are considered airborne, they're an aerosol, which are very fine particles that can linger in the air for up to 3 hours. Droplets are bigger particles, they have more saliva with them, and they typically fall to the ground within 30 minutes. Just talking at a normal volume can produce droplets that stay in the air for nearly 15 minutes. In the picture, there's a really cool image from a study they did, I believe, at Rutgers University, where they set up a mannequin and a fog machine and had the mannequin expel the fog at the same velocity and force as a human coughing. And then they used a laser to measure how much fog leaked out through different types of masks. They tested a number of different masks. So with no mask at all, the droplets and aerosols from the fog traveled 12 feet. With just your basic homemade fabric cotton mask, the particles only spread 2.5 inches, and most of that was up leaking onto the top of the person's face, so keeping it very contained. And then even a very, very loosely woven single layer bandana still cut the travel down to a quarter of what it had been, down to 3 feet. So like I said, the difference between aerosols and droplets, it comes down to the size. So aerosols are less than 5 microns in diameter, very, very small, and they can travel far greater distances than 6 feet. They can travel, up to 20 feet. Droplets are greater than 5 microns in diameter, and typically they can only travel a maximum of 6 feet, though there definitely are cases where droplets have traveled further, where, a fan system, or there's been something to really push that air, those bigger particles, further. A fomite is an inanimate object that can spread disease. like a doorknob, a light switch. Those are not how COVID-19 spreads. Originally, when we were first learning about the virus, we were all very, very concerned about touching surfaces, but COVID doesn't survive that long outside of the human host. It doesn't survive that long on surfaces, and you need, they're not 100% sure, but somewhere between 100 and 1,000 particles of virus is what it takes to actually infect a person. So you have to get a fair amount of virus, which just if they don't survive that long on surfaces, it's harder to get sick from that. So yes, you can get sick from a surface, but mainly you're going to get sick from inhaling people's aerosols and droplets. The survival time, it has a half-life of 6 hours. So that would mean if you coughed out 1,000 virus particles in 6 hours, only 500 of those particles would still be able to infect somebody. 6 hours after that, only 250 of the virus particles would be able to infect someone. They do think that the droplets, those bigger particles, contain more of the virus, and that they can keep the virus protected a little longer because the saliva keeps the virus from degrading. All right, do we have any questions on just kind of the technical aspects of the virus before we go on to the masks? Give it just a second.
Looks like there are no questions right now.
All righty. So using masks to prevent disease, it goes way, way back in history. I mean, you have plague masks in the Middle Ages, but for us, I stuck to a far more recent pandemic, which was the 1918 influenza pandemic. It killed 50 million people worldwide, and over 500,000 in the US. And just like with COVID-19, every state and region had their own rules and how they responded. So the Western states had mask ordinances. So along the Western coastline in Seattle, San Francisco, they had requirements that people wear masks. In some cases, it was a little backward because they required people to wear masks on the street and in public. But if you went into a private establishment, you could take off your mask. And of course, just like now, there were people who formed anti-mask leagues that felt that the masks were taking away their freedom. So San Francisco in 1918 had one of the most historic anti-mask leagues that formed for about a month to protest. But when medical historians have studied all of this, they've been able to credit masking, even though they didn't have the best masks, and usually they were made by volunteers. There's the Red Cross in this picture making masks. It prevented a lot of deaths. So we'll talk about fabric masks and their effectiveness, but we have a long history of using masks. We knew they were effective. We knew they were important before COVID. It's disappointing that they ever became a political issue with COVID because they are one of the simplest, easiest ways to prevent the spread of disease. And we'll talk about why. So this study took different types of fabric, and the whole thing was fabric you could find around your house. And compared their ability to filter out particles of less than 0.3 microns. And that's just the standard that's used for N95s, and the N95, the 95 stands for 95%. So it filters out 95% of those particles that are less than 0.3 microns. COVID-19, which is actually caused by the virus SARS-CoV-2, is typically about 0.05 to 0.2 microns long. But the thing is, it comes out in groups, it comes out in saliva, and those droplets, like I said in the beginning, they're over 5 microns. So the droplets themselves are much larger, and you can find that the filtering, when you do this standard of the less than 0.0 or less than 0.3 microns filtration, really it sets the standard. So it's doing a very good job keeping that in. So obviously N95 or a HEPA mask, which we'll talk about with the respirators, which are 99.9% effective, filters out 95%. A surgical mask is really going to vary based on the fit, the materials, the person's face, number of factors. So they can be between 60 and 80% effective. And we'll talk a bit about that on the next slide. But if you look at some of these other just found materials, vacuum cleaner bags have the same or greater efficiency than a surgical mask. Quilting fabric, which is just 100% cotton of 180 thread count or higher, double layer, that's got better effectiveness than a surgical mask. So, well, or better to equal depending on the fit. So 70 to 79%. So I have been in favor of fabric masks. I think there's a lot of good that can be done. If you notice, the pillowcases that have the 600 count, which is far more densely woven fabric than the quilting fabric, have less efficiency. It's because they're harder for the air to pass through, so they're not filtering as much as they're allowing leakage around the face. So there's just a lot of science. We have a lot of history showing that even fabric masks can do a lot of good for filtering out particles. So surgical masks versus N95. Surgical masks, they're used to protect the wearer from those big droplets, splashes, and bodily fluid, and then they protect the person around it from those larger droplets coming from the wearer. They're not usually that tightly fitted, and they're not super reliable on how well they filter things from the air because, different fits for different people. And they're not designed to be flush to the face. You're gonna get leaking through the sides, maybe under the chin, and definitely through the area around the nose, even with a nose clip. So they are good as far as like a daily wear, but they're not gonna protect you in a high risk situation. So for those situations, you need that N95 that has that consistent rated evaluation of filtering out 95% of particles. So they're effective for large droplets down to those small, less than 5 micron aerosols. They fit tightly to the face. And if they're worn correctly, they're going to have very minimal leakage. Do we have any questions about these before we move on?
Yes, looks like we have a question. So the
Okay.
first question is the human population wearing a mask this long in our lifetime bad for our immune system?
So that is actually a really cool question. It is not. So what they've been finding, and this is with fabric masks, I'm guessing the questioner is asking about, they've found in populations that had masking requirements for COVID-19 that when the general population, when people did get sick with COVID-19, they would have asymptomatic, less severe infections. And the theory is that that small amount of virus that could get in through the masks while people were wearing masks and going about their business in public, it was enough to start training the immune system to have a reaction and basically kind of not quite to the effectiveness of a vaccine, but it did train the immune system to have a reaction to low tiny doses of the virus. So then when people did get actively infected with the virus, their symptoms were far, far less severe or non-existent because their body already had a robust immune response. So it's actually pretty beneficial. And then I would say when we look at the number of flu cases and flu deaths since we started universal masking, just how much they've plummeted. And flu is usually a bigger particle than COVID-19, but very similar transmission, though you can get flu more easily off surfaces. I just think the benefits there are insane. I really, really hope as a people, we get in a culture similar to some Asian countries where it is standard practice that if you are unwell, you wear a mask if you do go out in public. So that's a really great question. Alrighty, so social distancing. The fabric face covering doesn't eliminate the need for that 6 feet of social distancing. And I wanted to talk really quickly about variants. So people are aware of variants to some extent or another. We are now at the point in Washington where the UK variant is the dominant strain that we're seeing in infections. And it is twice as infectious as the strain we were used to seeing. And we don't really know exactly what that means in terms of social distancing, but it means that, you know, that 6 feet may not be quite enough because you need half the amount of virus particles to get sick. You know, those masks are extra important while it's out there. They even think some of these variants might even be more and more infectious. And it makes sense. Basically, the virus adapts, it mutates to be able to infect more and more people. So the strains that can go further distances, that can get infected with less particles, those are going to be the ones that take over in a society. We've also, in some of my other talks, talked about how the variants impact the spike proteins, which are on the outside of the virus. We didn't go really into the structure in this talk, but those are what allow the virus to bind to your cells and infect you. And that's what all the vaccines target. They teach your body to react to those spike proteins and fight them off and have a good immune response. There is always the potential that the virus is able to mutate enough that those spike proteins don't quite look the way that we've trained our bodies with vaccines to react to them. So vaccines will need to be updated and changed as the virus changes. So if everybody in the space is wearing an N95, you can, or a higher respirator, you can really reduce that distance down. You still don't want people working side by side unless it's absolutely necessary. And if it is, you might want to consider some other things like additional ventilation or a barrier. And the next talk that we'll be doing in late April goes over ventilation and barriers. So just some stuff to think about. So what is a respirator? I have the full dictionary definition, but basically it covers your mouth and your nose, and it would protect people from a hazardous atmosphere, which is basically if the area where you're going to be breathing has fumes or vapors or gases or virus or bacteria or too much dust or anything like that. And there's two types. There's air purifying respirators, which you and your lungs do the work. Basically, you breathe in and you breathe through a filter cartridge that keeps, that filters out, you know, the virus or whatever your concern is. And then there's air supplied respirators, which actually deliver clean air to the person. So you're not doing the work, you're just having a constant supply of fresh air. For today's talk, we're really just going to focus on the air purifying respirators because unless you are a medical professional in a very high, like a COVID ward or something like that, you do not need that level of protection. So real basic, how do masks work? I got asked a lot about how, the virus is smaller than the holes in the mask. How does a mask help? And again, you have to think about those droplets, those bigger droplets that you expel. For the most part, they just hit the surface of the mask and don't go any further. But even those tiny particles of virus that aren't in a droplet, they're not going straight through. It's not, people I use an analogy of if you had a BB gun and a soccer net and you shot the BB gun at the soccer net, of course, it's all going to go through. But that's not how those really tiny particles travel. The better equivalent would be you have a bag of feathers and you want to throw those feathers at the soccer net. Some are going to go through the net, but a lot are going to go to the ground, off to the side. They just, when something's that small, it doesn't travel in that straight slingshot arc. So you don't necessarily have to have a mask that has such small holes that the virus, like smaller holes than the virus actually has. You just need to have, multiple layers that it can filter through. And these illustrations kind of impact that. On the left, there's a study that they did over in Europe, and they used tea cloth, which is basically, think of a bandana. It's very loosely woven fabric, and a surgical mask and an N95. And they measured how well it protected the wearer and how well it protected others. So the tea cloth protected the wearer, filtered about 33% of the particles out, which is still better than nothing. But when the wearer coughed, 90% of the particles still went through into the environment. And then the surgical mask protected the worker 75%, and then protected those around about 50% of the particles leaking. So just different concepts on how masks work. Do we have any questions on this? I want to get into kind of the meat and bones of the talk.
Yes, looks like we have one question.
All right.
And that is, what is the best way to double mask?
Okay, so this is a hard concept. It's going to depend on the type of masks. There's certain masks you don't want to double mask just because of different concepts. So I would say it's better to do the more filtering mask underneath. So the surgical mask underneath, or the N95 underneath, and then do a cloth mask over top of that. Because that way the closest to your breathing zone is the higher protection, and then you can use that larger fabric mask to kind of nip up the edges where you might get leakage around the nose and sides, especially on a surgical mask. So that is a good question. Definitely make sure they fit and that you can breathe well. I double masked recently for my first COVID vaccine, and the surgical mask was very tiny, and it kept pulling all of my mask off my face. So that would have been a situation where it probably would have been better to double mask with 2 fabric masks, or change the order. We get asked a lot about N95s versus KN95s. And on paper, they are very similar. N95s are certified in the US, KN95s are certified in China. They are both supposed to filter out 95% of particles less than 0.3 microns. That is not always the case quality control wise with the KN95s. So there's a list in here, the FDA's Appendix A, that give you the tested imported KN95s that do match up to the equivalent of that 95% efficiency. N95s have a stricter standard for pressure drop, which basically measures how easy it is to inhale or exhale through. So those are some things. You can't use them interchangeably, but in general, if you don't actually have a very high risk situation where you would need to be in a respirator, you can do that KN95 and it's going to give a fairly good amount of protection to your people. They're also easier to get a hold of right now. So face shields and eye protection. COVID-19 can actually be spread through mucous membranes like the eyes and the nose. And if you are in a close contact or high risk situation, you're going to want to protect the eyes. So glasses or goggles can be used, but glasses often fog with fabric masks. So a face shield isn't going to do anything to help with respiratory protection, but it does offer droplet protection for the eyes, and they're less likely to fog if you're using a fabric mask. Anybody have questions on this?
Yes, looks like we have a question. What would you say about people who only choose to wear a face shield as a replacement for a mask, especially in public?
Unfortunately, that offers about 2% protection, and it just really isn't adding anything to the safety without a mask. Used with a mask, like I said, it really helps with that eye protection. But without a mask, it does almost nothing to protect the wearer or people around them. Just a note, I'm not going to go through all of this, but you might have a worker who has a medical issue or disability that makes it impossible for them to wear a face covering. These employees would need to get an accommodation statement from their healthcare provider, and it needs to state that the employee cannot wear a face covering. And then you're going to need to work with your employee to figure out other things. Can they work completely alone? Can they work remotely? What can you do to limit the spread of the virus because they cannot be in a mask? And then you also want to be conscientious of people who can wear a face covering, but might have negative impacts. So a friend of mine is deaf in one ear and partially deaf in the other ear, and it's been incredibly difficult for her to communicate with people because she didn't realize how much she relied on reading people's lips. So it is possible to accommodate workers who might have those sort of disabilities by removing the masks. But you want to keep at least a 6-foot distance or keep some sort of clear barrier between them. So again, it's just like if there's someone who medically can't wear a mask, if you're removing your mask to communicate with a hard of hearing or deaf employee, you want to make sure you're doing other things to prevent the spread of the virus. So we're going to go through the risk classifications for fabric masks. Could people go ahead and share what industry they're in the chat box? Real quick before we go into this, and we can kind of figure out who the people watching are, what risk classifications their workers find themselves in. All right, so going into risk, these come directly from the Washington State guidelines on picking the right mask for the task. So negligible risk, that's people who work alone or they're driving by themselves and they don't have to wear any sort of a face covering, but they need to have one available. And then what they mean by alone is you do basically spend the whole day by yourself and you have little or no expectation of coming across another person. So that's somebody who's in an office by themselves with a door and, they wear a mask when they go out into the public part of the office. It's a landscaper who works alone, a crane operator in an enclosed cab on a construction site. Low risk is requires just a reusable cloth face covering or a surgical mask when risk for transmission is low. So that would be people who can stay 6 feet apart from others, except for maybe passing up to several times a day. And then if someone provides service to a healthy client who also wears a face covering. So that would be a custodian who's not cleaning up after known COVID-19 cases, somebody giving a haircut and the client's also wearing a mask. And then like waiters at a restaurant where their only interaction is curbside pickup. So their clients are wearing a mask too. Medium risk masks, you could include a disposable dust mask, and a dust mask is not a respirator. It is not an N95. So for medium risk, you can use a dust mask, you could use a KN90, a KN95. And this would be workers stay at least 6 feet away from each other, except for several times through the day for several minutes. And you can't use physical barriers. So this would be people commuting in a compact car for up to an hour, and they're only 3 feet apart because it's a little car. And then you'd want the windows down and a ventilation system running. And then as far as personal services, so hair cutting, nail salon, things like that, employees are medium risk when 3 to 6 people are working in a room with healthy clients who are all wearing a cloth face covering. High risk is requires respirators, which are N95s, or this is a half face reusable silicone respirator with P100, so HEPA cartridges on it. And those high risk situations are when employees work or travel within 3 feet of each other for more than 10 minutes, an hour, many times a day. If you're cleaning an area that was occupied by somebody with known COVID-19, people who perform procedures that aerosolize saliva or mucus. So it's people performing spirometry, respiratory therapists, dental services. And then people who are going to provide a service to a client that has a known COVID-19 infection. Extremely high risk, people must be in an N95 half or full face respirator or a powered air purifying respirator, where basically it uses a battery pack to help filter the air so your lungs aren't getting as much as a workout, or surgical mask with eye protection, or other NIOSH approved respirators that are from outside the US. Workers also need to wear goggles or face shields to protect their eyes, unless they're wearing a full face respirator, which comes up and includes the eyes as well with a clear plastic screen. They need to have the client in a surgical mask or other type of mask, depending on the supplies. And then risk is extremely high if employees are transporting people with COVID-19 or work in residential or non-hospital clinic sessions within 6 feet of someone infected with the coronavirus. So those are kind of when you need to have a respirator. This section is on building a respiratory protection program, and it's relevant for any workplace that requires an N95 or greater. I'm going to basically only talk about it in relation to COVID-19, but these rules are the same if your workers exposed to silica or lead or asbestos. So this section is really useful to anyone regardless of their actual COVID-19 risk, based around whether or not they use an N95 or greater. Do we have any questions on any of the risk categories I just went through before we go into building a respiratory protection program?
Looks like we have another question. So they said, what are your thoughts on working out and wearing a mask?
It is, in general, not going to harm anyone at all. Well, okay. So wearing a mask, because it does filter, and again, I'm assuming this is a fabric mask or like a surgical mask, because it does filter, it does put a little additional strain on your lungs. A healthy person, that is not going to impact it. It's actually going to help them, become a better athlete. They're going to have stronger lungs and more breathing capacity. If you are someone who has asthma or other lung impacts, that wearing a mask and then doing that exercise activity can trigger a bronchospasm, can basically have your lungs work too hard. So if you have that sort of history, you're really going to want to talk to your medical provider before you start working out in a mask. But for the average healthy person, it will put a little bit more strain on them, but in the long run, it will make them a stronger athlete.
Does that include people who smoke a lot?
People who smoke a lot are probably going to have a harder time wearing a mask and working out. And they would definitely want to talk to their doctor, hopefully about doing a smoking cessation program, but they would want to talk to their doctor about what activities and the safest way to increase their activity load while wearing a mask. These are good questions. All righty, building a respiratory protection program. So required, everybody who has their people in an N95 or greater respirator has to have a written program. I do include a link in here to the Washington State L&I page, has sample respiratory protection programs. So you don't have to create it all from scratch, but you must have one. And it's going to include, what are your standard operating procedures? Why are your people in respirators? What's the risk assessment? Is it COVID-19? Is it silica? How are you picking the respirators used? And for this talk, we're really only talking about N95s and P100 filtration. We're not going to talk about things that filter out acid gases or things like that, but that could be very relevant to some workplaces. So you need to talk about what type of respirators you're using and what type of cartridges, what medical screening is required, what training requirements, fit testing, how are you going to take care and maintain the respirators if they're not disposable, the medical program that might be required, if you have people working with lead or asbestos, record keeping of those medical records, those are sensitive documents, and, an annual evaluation of the program. It's going to include the medical clearances, which are required for both voluntary and required use. And we'll go into the difference between voluntary and required use of a respirator. But regardless, since they are those higher filtration values, they do put more work on the lungs. And you have to know that people are healthy enough to breathe with them on. And then fit testing shows how well a mask actually fits a person. Is it actually fitted well enough to where it's filtering the amount it says it's filtering? And that is not required if people are voluntary choosing to wear a respirator. So voluntary versus mandatory use, and I apologize, this flow chart's directly from OSHA and it's a little blurry, but you can find that in some of the links I reference at the end. But voluntary use, the worker wants the extra protection, but there's no established need for that. So, they want to be in an N95, but they work alone in an office. They're welcome to wear it, but there's no demonstrated need that they need to wear it. If the hazard exists that requires a respirator, they're getting exposed to silica dust on a construction site, or they're working in a medical facility with active COVID patients, they're in a COVID ward, that's not voluntary, that's required use. So you have to have that medical clearance that says you're healthy enough to wear a respirator, but you do not have to have the fit test if there's no actual need to be wearing the respirator. So the type of respirator you're using depends on the risk. So for coronavirus, those are those medium to high risk situations where a worker is healthy enough to breathe through a respirator, and an N95 or higher can be used. A half face or full face respirator with P100, those are the purple cartridges, can be used. And then a PAPR, a powered air purifying respirator, which is the one I said uses a battery to basically push air through a filter so your lungs don't have to work as hard. Those can be used in high risk situations to make it easier for the person to breathe. Wearing a respirator for an 8-hour day is a lot of work on your lungs, and it is exhausting, even if you are healthy and medically cleared. If you have other hazards in your workplace, those respirator requirements are still in place. So if your workers are exposed to silica, lead, asbestos, certain chemicals, dust, anything above those permissible exposure limits designed for those different hazards, you have to have them in an appropriate respirator. So the medical clearance is required, but the type of screening is really gonna vary. What type of respirator is the person wearing? How long will they be wearing, both in like number of days? Is it 3 days a year? Is it 15 minutes every other day? What is the amount of time somebody's going to be wearing this respirator? What's the age and pre-existing condition of the worker? Are they a smoker? Are they 25 and perfectly healthy? And then what is the worker being protected from? So at the bare minimum, the worker would be given a secure medical questionnaire that is filled out and confidential, and it's reviewed by a doctor. And it's going to ask all of those questions above, plus a lot more, get a medical history of the person. And if there's nothing that triggers any red flags, the doctor might say, yes, this person is able to wear a respirator based off of what I'm seeing here. If it has some concern, maybe the person has a history of asthma, the doctor might say, I need this person to come in for a physical, and it would include spirometry, which is where you breathe into a tube basically, and it measures your lung capacity. And then for things like asbestos, it could even go further. They could want lung x-rays, things like that. These medical clearances, the doctor will basically send a yes, no type form. Yes, this person can wear a respirator. No, this person is not medically cleared to wear a respirator. You won't have access to your employee's medical history beyond that, but these forms are considered secure medical records and they need to be kept in a secure location by a trained individual, usually your HR or safety person, depending on the size of the office and what you guys do. So a fit test, do you have any questions on medical clearances or those aspects of respiratory protection program before I go on?
No questions.
All righty. So what is a fit test? It shows how well the mask fits the wearer's face. There's both qualitative, which are just pass, fail, and quantitative fit tests. So the most common fit tests for an N95 mask are Bitrex or saccharin, which are tests where basically you put the person in that nifty little hood and you squeeze in a chemical that has either a bitter or a sweet taste. And if the person can taste it, the mask doesn't fit well enough. It means they're getting leaking around their mask. And then irritant smoke tests, usually you don't use those as much for an N95, but I like them right now because you do them outside and you don't have to put anyone in a hood that needs to be clean between each person. So I like them, even though they are exactly what they say they are. They are an irritating smoke that makes the person cough if it breaks through. So it's a little harder on the person, but I find you can't lie about an irritant smoke test. Some people don't necessarily have a good sense of taste or smell, but the irritant smoke test is really going to tell you whether or not the mask fits. So that's what a fit test does. It makes sure that the mask is fitted properly, so it actually filters out the amount of virus or other hazard that it says it will based on its rating. So the training, you have to make sure people are trained to wear their respiratory protection properly. They know how to maintain it. If it's not a disposable mask, it does need to be cleaned. They need to change the cartridges as needed. They need to store it in either a bag or I like shoe boxes, those little clear plastic shoebox totes for these. They make sure it's not exposed to excessive heat or cold. And then they're going to need to have records of the fit testing and the training in the written program. Care and maintenance, and this is all required elements of the written program. So they need to be inspected every time before use for cracks or deficiencies. And this is the reusable half faces. For an N95, you would want to make sure if you are reusing it that it's clean, it's not soiled, it's not bent or torn. You want to clean the respirator both before and after use. They make special alcohol swabs and special respirator disinfectant, but you can use anything that is safe to be on human skin. So medical swabs are good. And then to deep clean a respirator, you break apart all the pieces and you can scrub it in water and mild detergent, or they make commercial respirator cleaning solution. The N95s are not designed to be clean, though they have devised a number of technologies, UV lights and things like that. But unless you have that technology, which is mainly at medical centers, they should just be thrown away once they're visibly soiled. And then you want to store the respirators out of heat and sunlight. Those can cause it to degrade. One of the big issues at the beginning of the pandemic, we had stockpiles, national stockpiles of N95s. Well, the elastic that goes behind your head and keeps it pressed tight to your face, it had degraded after years of storage, And so we had a bunch of useless N95s. So you want to make sure you're storing things the way that maintains them. Record keeping. You need to keep a copy of the employee's medical clearance in their confidential medical file for the duration of their employment plus 30 years. It's very serious part of the record keeping. And then annually, you need to review your respirator program, or if you're changing the respirator type or conditions, maybe your people started wearing respirators because of COVID-19, but they need, or a more realistic, maybe your people already were wearing respirators for silica, and now you've added COVID-19 risk so your people can work closer together on a job site. So you need to update for that. Before we go into troubleshooting, does anyone have any final questions about the elements of a written respiratory protection program? There's a lot I didn't go into on selecting the filter cartridges, as I said, for what we're talking about with COVID-19, the N95 and the P100 is going to be sufficient. For a number of other hazards, you're going to need to be familiar with what the correct cartridge to filter them out would be.
No questions.
All righty. So just some basic troubleshooting. If your employee has trouble breathing in a face covering or has a medical note excusing them from wearing a face covering, you would want to offer remote work wherever possible or as much as possible. Maybe there's one day a week they have to come in. You'd want to arrange for the worker to work alone in a contained area. And if the employee can wear a mask but has trouble wearing a mask, offer them frequent breaks outside where they can take off the mask and kind of breathe freely. If your employee feels claustrophobic or panicked in a face covering, which was a pretty common thing, especially at the beginning of this, because it's such a new thing, you'd have the same steps as a person who can't breathe or has a medical issue. And encourage your employee to practice wearing their mask in a safe, calm environment for just short periods of time. So wear it at home in the living room for just short little stretches and get used to it in a place that you're really comfortable and you can kind of mentally push past those feelings in a safe, secure thing. And I definitely don't want to make fun of anybody who can't wear a mask or has these feelings. They're very legitimate. They can be from all sorts of trauma or past history. So, you can work with a professional on this, but just starting wearing it and acclimating yourself to it in a situation where you can control everything else and get comfortable, that's really going to help. And then glasses fogging, that is probably the hardest thing about masks. A face shield can help, or using goggles instead of glasses that fit really flush to the skin. There's also anti-fog sprays that construction retailers, ski rail retailers have, so you can spray those and try those. Getting a nose clip for your mask, if it doesn't already have one, can really help. They make nose clips that you can either sew into a fabric mask or put on top. So glasses fogging, my background is construction. I'm very sympathetic to it. So try the different troubleshooting, give your employees, time to step away, go outside, clean their glasses, and just, make it work as best as possible and understand that sometimes things are going to take a little longer with these additional precautions. All right. That is this talk. I did not include references on this, but the references will be available on our education page, our website. So my contact info is here if people ever want to reach out to me directly. Do we have any questions on this? We have a lot of time. If there's anything you want just troubleshot for your company or anything in addition, please feel free to write it into the chat box.
So it looks like we have 3 questions. So the first one is, how should the mask be stored? For instance, when carrying it in a bag, can you put a clean mask loosely in a bag with your wallet, phone, and other objects?
So if it's a fabric mask, technically, yes, I would say that's kind of gross. But technically, there's no reason you couldn't store a fabric mask. But you do risk the possibility of all the germs, which are probably not COVID-19. They're probably, types of staph and things like that on your wallet and keys, getting on that face mask, which you will then put on your face. So I keep just Ziploc baggies of clean masks in my car, in my purse, things like that. And then I have a dirty Ziploc bag. And once a mask has been used, there's another thing as far as troubleshooting. If your employees are having, skin reactions, things like that, to wearing a mask, changing out your mask every couple of hours can really make a difference. So, yes, as far as a fabric masks go, technically you don't have to do anything special, but I like to keep them as clean as possible. So a Ziploc or a container before anything goes on my face. For the actual respirators, the N95s and above, they do have those storage requirements. So they do need to be kept in a clean bag or container between uses, and they can't just be stuffed in a truck seat or in a purse or anything like that.
All right, and then the next question is, how should a mask fit exactly? When I wear a medical mask, I notice that there's a little gap next to my cheek between the mask and the cheek. Is that okay?
Well, you want things to fit as flush to the skin as is comfortable. I mean, when we're talking N95s and other respirators, they're not quite comfortable because they have to have that seal. With a surgical mask or a fabric mask, you're not going to want to be like digging into your ears or skin to make them flush, but you do want to try and limit major gaps. So with a surgical mask, if it's really big, you can try putting one twist in the ear elastic, basically. So one twist that would go kind of on your cheek, and then you still do the ear loops as normal. And that can help bridge a gap. With fabric masks, sometimes if you have a smaller face, you might want to sew just a little tack, a little fold into the side to get it as close to the fitting to the face as possible. So you don't want to be in pain, but you do want to minimize major gaps. All righty, what's the last question?
Okay, so the last question is, can someone not wearing a face mask over their nose expose someone to COVID-19 if they are sick?
Yes. So the virus, it lives, they found it in the saliva glands, but they found it in the back of the throat, in the nasal cavity, in the mouth. So as anyone who's had a COVID test has known, they go through the nose to get the far back of the throat through the nose. And that's because that's where they figure the amount of virus is the highest amount. So you're most likely to get an accurate test result. So if you don't wear the mask over your nose, that's a whole area of basically potential virus reservoir that you're not covering or filtering. So you basically might as well not wear a mask. I'm sure breathing out has more velocity and coughing has more velocity, so probably can spread more, but it really would ding the efficiency of wearing a mask at all to have the nose exposed.
Great, that was all the questions.
Fantastic. Well, thank you so much. This will be available in about a week or so on our YouTube channel, and check out our website. The next talk coming up, like I said, is barriers and ventilation. And that'll be the end of August or the end of April. We're hoping for April 29th. And then in May, we're going to do some more exciting topics addressing variants, getting accurate information, helping your company prep for the next outbreak. So I'm hoping to see more people at our upcoming talks. Thank you.